Good afternoon and welcome to Tyler Cappel, Legislative District Candidate from District 38. Thank you, Tyler, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and joining me today are AARP lead advocacy volunteers Susan DeCamp, Joyce Beck, Tim Potter, and Mike Barwick. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. Tyler, we appreciate your taking the next 30 minutes of your time to meet and discuss issues of importance to the 50-plus voter and their families in your district and across Nebraska. As a short background, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering and strengthening people 50 and older to choose how they live as they age. As people live longer, healthier lives, we know we need to think differently about what it means to age. So with that, Tyler, if you want to start us off by giving us a little background about yourself and your campaign, I'm thinking about 5 minutes or less on that, that would be great.
Sure.
And once we've completed your opening, we'll move into the questions. So I'll pass it back to you, Tyler.
Yeah, so I'm a personal trainer. I've been doing this for about 15 years now. I have my own training studio in Arapahoe, and I work along with my wife, who's a chiropractor. So I'm really big into physical fitness, and hopefully helping people age gracefully is very important to me. So we have 3 children, ages 11, 6, and 3. Yeah, we've been here back in Arapahoe for almost 10 years now. We moved back from St. Louis back in 2013. So I coached Legion baseball for Arapahoe and Cambridge this last summer. Was the first year we'd had Legion ball back in probably about 8 years or so. I've served on the library board and just do raise the kids and take them to and from sports and stuff, and that's about it.
That's your hobby, right, Tyler?
What's that? Yeah.
I think that's your hobby, is your kid.
It is, absolutely. Yeah. So I'm a libertarian. I consider myself a constitutional conservative. And I'm sure we'll kind of get into some of that other stuff as we move forward with some of these questions. So.
Perfect. Well, thank you, Tyler, for taking the time. Thanks for always sharing about your family. We always love to hear that. And of course, your bio and certainly some of the values that you bring to the table. We have provided you with a set of 3 issues containing 4 questions that pertain to the 50-plus in Nebraska. And each of the questions, we're looking to allot about 5 minutes of discussion for each of those. So the first question today is on health, caregiving, and home and community-based services. And Susan DeCamp's going to take that one. Go ahead, Susan.
Thanks, Gina. Good afternoon, Tyler.
Hello.
Nice to meet you.
Good to meet you.
So home and community-based services, also known as HCBS, provide an array of services to help people with daily living activities that promote independence, which allows them to stay in their own homes and communities and age in place and delay that institutional care. Mm-hmm. Family caregivers also provide care for someone who's not able to live independently. These caregivers are family members, friends, or acquaintances, and oftentimes they provide this care without any pay. So we have found that telehealth services can be significant for seniors, particularly in the rural areas and underserved communities, and they can also provide support to family caregivers by reducing their travel, wait times, and costs associated with caregiving. So we have a couple of questions on that topic for you. The first question is, what will you do to support the 240,000 unpaid family caregivers in Nebraska through policies such as enhanced respite services, access to telehealth, caregiver education and training, and help with out-of-pocket expenses? And the second question is, what will you do to protect and or expand the home and community-based services programs, particularly recruitment and retention of a sufficient workforce, and also adequate funding of the services that Nebraskans and their families rely on?
Oh, great questions. I'm very in favor of the telehealth medicine. I think that's a really good idea. What we need in the healthcare industry is just more innovation. Innovation brings costs down. Innovation brings quality of care up, and it's best and it's good for the consumers. So anything we can do to reduce, barriers to entry into specific, fields of expertise or work would be helpful. Like I said before, of course, increasing access to the telehealth medicine, that's going to be really important. And yeah, I mean, this isn't an area that I have a lot of expertise in, but in general, I'm very much in favor of deregulation, increasing competition, and again, getting rid of those barriers to entry for jobs.
Okay,
And what was
great.
your second
Thanks.
question?
The second question was, what would you do to protect or expand the home and community-based services program? You talked a little bit about recruitment and retention of a sufficient workforce, and then adequate funding of these HCBS services.
Yeah, especially in rural Nebraska, there's, I think we're all experiencing, a housing shortage right now. So it's hard to attract new workers into our areas. It's hard to keep people in these jobs because they are low paying. So there's certainly a lot of problems, and it's hard to nail down as to what would be the best way to, again, to improve these conditions. But again, I think deregulation, same answer as before, is just deregulation, increased competition. I don't think government does a very good job of, of picking winners and losers and trying to fund these big programs. I mean, there are certainly some things that we can do, but I think government gets in the way more and does more harm than it does good when you just let people, work on their own a little bit and not necessarily fend for themselves, but rely on their own communities and rely on their civic organizations. I think our society will operate a lot better.
Thanks very much for your answers.
Thanks, Tyler. Our second question now, we're going to we'll switch into more of the facility type of discussion where people are residing in a facility. So this talks about nursing facility quality, and Joyce Beck is going to take that. So go ahead, Joyce.
Okay, thank you for taking the time to meet with us today, Tyler. Over 20,000 Nebraskans require care in nursing homes or assisted living communities, but facilities have closed their doors, citing reimbursement challenges and staffing shortages. Nebraska will need an additional 4,700 more nurses, LPNs, and RNs by 2028 to meet Nebraskans' care needs. Everyone, regardless of where they reside, deserves to be treated with dignity and respect and have access to quality medical care. Better staff to resident ratios improve the overall quality of care and the well-being of residents. Workforce recruitment, retention, and job satisfaction challenges are prevalent across long-term care services and the support industry. Causes of workforce challenges must be identified and implemented to respond to the growing need for high-quality care. So here's my question for you. What will you do to improve the quality of nursing facility care for Nebraskan residents, including addressing the growing long-term care workforce crisis in the state, professional education and training, and accountable facility reimbursement?
So here in Arapahoe, we actually had our nursing home closed down at the end of last year. And so we had about 25 residents who had to be moved elsewhere to different nursing homes. And I know there's been 2 or 3 other nursing homes that were all owned by the same organization. I think it was Sanford Health out of South Dakota that closed them down. And one thing that I was really upset about was the fact that Sanford Health received, I forget the exact number, but it was like $600 million from the federal COVID relief fund or whatever. I don't even remember exactly what it was, from what fund they got, but it was from the federal government. And then their CEO retired just a few short months later and received, I think, a bonus, a retirement bonus of like $40 million or some astronomical number like that, which is just, to me, it's just disgusting because, you know, our nursing home, they sold our nursing home to Sanford Health. Was it, I don't remember, again, numbers, maybe 15 years ago, for a very, very small amount. And so I preach a lot of localism. You know, we've really got to focus on our communities taking care of ourselves. We've got to get government out of honestly out of the healthcare industry. I know this goes completely against the grain, but when government gets their hands into these issues and these policies, again, the regulations go up, the cost goes up, the quality goes down, and it's because of what's going on right now that we're having the shortage in staffing problems. We're having shortages in housing. We're having all of these problems, and so again, I think it goes back to, again, you're probably going to get the same answer out of me for just about everything, and that comes back to, again, deregulation. You know, lowering barriers to entry. You know, my wife's grandfather just moved in with my mother-in-law just a few months ago. He's 89 years old. He'll turn 90 in November, and you know, and my mother-in-law is not certified to take care of an elderly person. You know, she shares a bedroom with him because they live in a small house. They live in a 2-story house where there's, you know, just one room on the main floor, and he can't get up and downstairs. So again, the idea that we think we have to have, you know, people with, you know, gobs and gobs of training to get into these positions to take care of our elderly people, I don't think is necessarily the exact right answer. You know, we just need people that are caring enough and willing to treat our elderly people with the respect that they deserve, and have, you know, loving attitudes towards them. That's what we need. And again, and this is going to be solved by having more localism and not letting the government get their dirty little hands on everything. So.
Okay, well, thank you so much.
Thank you, Tyler. Our final question for discussion today centers around livable communities and helping people stay in their home. And Tim Potter is going to take that one. So go ahead, Tim.
Okay, thanks, Gina. And thank you, Tyler, for being with us today. A livable community is safe and secure, offers affordable housing and transportation options that allow individuals to travel by multiple means, and provide supportive community features and services for people of all ages, allowing people to remain in their communities as they age. Affordable and reliable healthcare and transit options are critical to support older Nebraskans aging in place. High-speed internet should be affordable, reliable, and accessible for all Nebraskans. Digital skills development is also essential to obtaining the benefits of high-speed internet access in the home. So my question is, what will you do to ensure all Nebraskans, mainly those 50 plus, have access to livable communities which offer affordable housing, diverse transportation options, adequate health care, and affordable, reliable, and accessible high-speed internet, including digital skills development?
That's a tough one, certainly. You know, our hospital in Cambridge, they offer transportation to and from appointments. One of our physical therapists and again in Cambridge, they offer a bus service to and from appointments. You know, it's a complicated issue because there is so much government involved in all of these issues. And you know, it'd be easy just to say, well, we just throw more money at the problem. But I mean, we've all seen what throwing money at problems does. It just creates, I mean, it may solve some problems, but it also creates other problems as well. So, I mean, you know, a simple answer would be to say, make sure that these programs are funded, but that's, you know, not really an answer because, you know, it's easy to say that to people it's easy for people to hear that message. But when you get down into the nitty gritty of it, it's not a simple problem, because, you know, we can't just keep funding more and more programs while keeping our taxes low. I mean, we certainly don't have low taxes in Nebraska in the first place, but people want lower taxes and they want all these services. So you can't have both. So you certainly have to make decisions on which programs you're going to prioritize. You know, are you going to prioritize Medicaid and our education system and our roads? Or are we going to continue doing little, you know, pet projects by, you know, whatever it is? There's certainly lots of little pet projects that you know, the state has. So again, it's going back to making decisions on what's important. You know, certainly I think, you know, there is an importance for Medicaid, because there are people that don't have the ability to take care of themselves, and they do need assistance. And I would certainly like to see more local groups involved in the communities, doing things to help out elderly residents, so that way there is less reliance on government help. But that's something that we have to figure out. It's not an easy solution. But I know for a fact that if you get, you know, the right people onto a problem like this, we're going to figure it out. And we, again, cutting regulations, increasing competition for different services, that's going to be, I think, go a long ways towards solving a lot of the problems that we have, especially in the healthcare industry.
Okay, well, thank you for your views on that.
Yeah.
Thank you, Tyler. And that kind of concludes the question section. We are coming to the end of our interview today. I would like to offer back to you some final minutes for any closing thoughts or comments that you might have for our members, and of course the constituents that live in your district. So the floor is back to you. If you have anything else you'd like constituents in your district to hear, go ahead.
Sure. You know, when I've been knocking doors quite a bit lately, and when I talk to people, you know, the economy is certainly a major issue for a lot of people. You know, especially people on fixed incomes, because their Social Security payments aren't going as far, purchasing groceries or purchasing gas. You know, our heating bills and cooling bills have all gone up, and they might continue to go up here this winter. So people are really concerned about, you know, what's going on, particularly in our federal government. And so one thing that I really stress about is political decentralization. And that's, you know, partially because a lot of what our federal government does is unconstitutional. It's not been authorized by the Constitution. And so when that happens, it is up to the states to start pushing back, and start using the 10th Amendment to nullify unconstitutional laws and mandates. And we've got to get the power back to the states and ultimately back to the people. But again, it sounds like an easy solution, but it's going to take hard work, and it's going to take Nebraskans that are really fed up with how things are being ran right now, if we want to see some serious change. That's pretty much my whole campaign spiel when I talk to people at the doors. You know, that's what's important, because we can't continue going down the road that we're going down right now on a federal level, because it trickles down into our states and it trickles down into our communities. So like I said before, it's time for Nebraskans to start taking a stand, and pushing back against what's going on in our federal government. Because if we don't, our communities will be lost. Our small town rural Nebraska values will be lost, and we'll have nothing left. That's my belief, but yeah.
Perfect. Thank you, Tyler.
Yeah,
thank you again for taking the time to visit with us. We wish you the best with your campaign. And thank you most of all, for taking the time to meet with AARP today. We really appreciate it.
Yes, thank you for inviting me.
Absolutely. Take care.
All right, thanks. You too.